Can STIs cause problems with ovulation? Imagine a tiny disruption in your reproductive system that could have big effects on your ability to conceive. While sexually transmitted infections do not usually directly stop the ovaries from releasing eggs, they can cause problems that make conception more difficult. The main way they do this is through a condition called pelvic inflammatory disease, or PID. When certain STIs like chlamydia or gonorrhea go untreated, they can travel from the vagina or cervix into the upper reproductive organs, causing inflammation and damage. This damage often affects the fallopian tubes, ovaries, and uterus, leading to scarring. Scar tissue can block the fallopian tubes, which prevents the egg from meeting the sperm or stops a fertilized egg from reaching the uterus for implantation. This type of damage is a common cause of infertility in women and can account for about a quarter to a third of all cases. Even if the ovaries themselves are not directly damaged, the inflammation from PID can interfere with ovarian function. For example, it can disrupt blood flow or damage the tissue that helps the ovaries produce eggs. Some STIs also produce toxins or substances that harm the tiny cilia lining the fallopian tubes. These cilia are like tiny hair-like structures that help move the egg toward the uterus. When they are damaged, the egg may not reach the sperm or the fertilized egg may not reach the uterus properly, making conception harder. Certain infections like chlamydia and gonorrhea are especially known for causing these issues. Chlamydia can produce toxins that harm sperm and cause inflammation that affects ovulation. Gonorrhea can damage the ciliated cells in the fallopian tubes, reducing the chances of successful fertilization. Trichomonas vaginalis, a protozoan STI, has been linked to inflammation in the upper reproductive tract, which might contribute to infertility, although clear evidence connecting it directly to ovulation problems is limited. It is important to remember that many STIs can be silent, showing no symptoms at all, yet still cause serious damage if not treated early. Regular screening and prompt treatment are essential to prevent complications like PID. Protecting your reproductive health means staying informed, practicing safe sex, and seeking medical advice if you suspect an infection. If an STI causes damage to the reproductive organs, it can indirectly affect ovulation by impairing the environment needed for egg releases and fertilization. Always consult healthcare professionals for personalized advice and treatment options to keep your fertility healthy.